I want to put more radioactivity into people. Actually, I could do with some volunteers. Are any of you interested at all? No, I didn't think so. You see, radioactivity gets a really bad press, doesn't it? But what we don't hear about is that we can use it to find out about the biological processes happening inside our bodies and to diagnose diseases, such as cancer or Alzheimer's disease, far earlier than we'd otherwise be able. And we can do all of this through a technique called positron emission tomography, or PET. And how this works is that we make a small amount of a radioactive substance, called a radiotracer, that is designed to bind specifically to a biological target of interest. This is injected into the patient, and as it makes its way through the body, if it comes across the target, it will bind and accumulate there. Then when we scan the patient, the radioactivity allows us to see exactly where and how much of the tracer has bound. Now, you've heard of medical imaging techniques like X-ray, MRI, so why do we need another one? Well, while those other techniques are good at looking at the larger structures in the body, like the bones or the brain, what's special about PET is that we can look at the molecules involved in a particular process, which gives us far more detailed information. Now, PET is a relatively new technique, which means there's this whole body of research into its incredible potential. And yet, so little of that has made its way through to the patients who need it. And it is incredibly frustrating to see all this potential, to see the sick people, and not to be able to bring them together. And this is where our project comes in, because one of the barriers in translating the potential of PET to the patient is the difficulty in making the radiotracers. We're dealing with radioactivity here, so we can't use conventional chemistry techniques where we just dive in, we get our hands dirty. Instead, we actually want to limit manual access and ideally have the whole synthesis performed by a machine. Now, the key property of radioactivity, as you know, is that it decays with time. So you've always got your eye on the clock, just like I have now. And in fact, in the 3 minutes that I hope I will finish this talk in, I would already have lost 10% of the radioactivity that I started with. So the synthesis and purification have to be really quick and efficient, which presents a massive challenge. So what we've done is develop a whole new approach to making radiotracers that allows far quicker and easier purification than existing methods. We've developed this in the chemistry labs, we've adapted it to radioactive chemistry, and we've shown that it works for a well-known radiotracer, so it's looking really promising. And the nice thing is that while we've shown it works for one tracer, it could easily be adapted to lots of other radiotracers. And this way, we hope we can really expand the range of tracers available for PET imaging, and thus accelerate from potential to patient. Thank you.